Hello everyone, this is Candace with Courage to Save CPR Training and the lady with the purple prescribed glasses. Our C, Counseling, Mentoring, and Coaching. P, Programming and Education. R, Response Readiness Training, aims to strengthen skills, abilities, processes, and resources that are needed to adopt and thrive in a fast-changing world. Thank you so much for joining us for part 2 of Let's get into cardiovascular disease. Remember, we will use cardiovascular disease, CVD, and heart disease interchangeably. Today's subject is going to be a little longer due to the nature. Knowledge is half of the battle. No one has ever won a war without being fully equipped. In this video, we're going to discuss the most impacted groups of heart disease and why. So let's get into it. According to cdc.gov, one person dies every 34 seconds in the United States from heart disease. In 2020, 697,000 or 1 in 5 people died from heart disease. Now remember, 2020 was the height of the pandemic, so that may have played a part in those drastic numbers. Heart disease cost about $229 billion from 2017 to 2018. This includes the cost of healthcare services, medicines, and loss of productivity due to death. Make no mistake, heart disease doesn't discriminate. However, there are groups who are more impacted in comparison to others. These groups will be sorted by the following categories: age, gender, and race for today. So let's go ahead and get into age first. So heart disease can happen at any time. According to the National Institute of Health, adults 65 years and older are more likely to suffer CVD. Aging can cause changes in the heart, blood vessels, or both. And those changes in the heart and blood may increase a person's risk of developing heart disease. Based on the information in cdc.gov, high rates of obesity and high blood pressure among people ages 35 to 64 are at risk of heart disease earlier in life. Nearly half of all Americans have at least one of the top 3 risk factors. They are high blood pressure, unhealthy cholesterol levels, and or they smoke. Younger people are not off the hook as it relates to heart disease. According to data researched by the American College of Cardiology, heart attacks are striking those under age 40. Their study, which is the first to compare young 40 to 50-year-olds to very young 40 or younger heart attack survivors, found that among patients who suffer a heart attack at a young age, of their overall 1 in 5 is 40 or younger. During the 16-year study, from 2000 to 2016, the proportion of very young people having a heart attack has been increasing, rising by 2% each year for the last 10 years. Despite being 10 years younger, or on average, than those who are having heart attacks in their 40s, very young patients have the same rate of adverse outcomes, including dying from another heart attack, stroke, or any other reason, even if they're in their 20s or 30s. Once they've had a heart attack, they're at risk for more cardiovascular events and have just as much risk as someone who may be older. Based on the findings of Ron Blankstein.MD, a preventive cardiologist at Brigham and Women's Health, an associate of Harvard Medical School in Boston, and the senior author of this study, he shared that traditional factors for heart attack including diabetes, high blood pressure, smoking, and family history of premature heart attack, and cholesterol was similar between the two groups. However, the youngest groups who are more likely to report substance abuse, including marijuana and cocaine, 17.9% versus 9.3% respectively, had less alcohol use. I'm sorry. The comparison between the young heart attack victims versus the very young heart attack victims, they used a patient angiograms, which is a procedure that uses X-rays to see the heart's blood vessels and arteries, to find that people in the very young heart attack group, were more likely to have heart disease in one vessel, suggesting that this disease had the same rate of bad outcomes. The very young group also had more spontaneous coronary artery dissection, which is a tear in the vessel wall, which, while rare, tends to be more common in women, especially during pregnancy. Now, let's jump into gender. According to the American Heart Association Journal, CVD has long been seen as a condition primarily affecting men. Age-specific rates of CVD are higher for men than women. However, the actual lifetime of CVD is similar for men and women. Younger women have more favorable lipid profiles than men, but cholesterol levels rise after menopausal transitions to levels higher than men. The lower rates of high blood pressure or hypertension in women than men could be attributed to women's stronger anti-inflammatory immune profile, which can limit increases in blood pressure. Tobacco use is generally more common in men than in women, and women tend to have more favorable levels of blood pressure and cholesterol, which leads to the next point of heart disease in pregnant women. Cardiovascular disease is a leading cause of pregnancy complications among all women. According to American Heart Association Journal, the rise in maternal mortality has been attributed to increasing numbers of women at advanced maternal age undertaking pregnancy. Comorbid pre-existing conditions such as diabetes, mellitus, and hypertension, and the growing number of women with congenital heart disease surviving to childbearing age. Racial and ethnic disparities in pregnancy-related mortalities are significant. Black women are 5 times more likely to die from pregnancy-related cardiomyopathy, which is an abnormal thickening of the heart muscle, than white women. According to Marian McCormick of the Maryland Population Research Center at the University of Maryland, Black women face maternal death rate 2.5 times that of white women. Disparities of the racial groups were concentrated among a few causes of deaths: postpartum cardiomyopathy and blood pressure disorders such as preeclampsia and eclampsia are related causes of maternal deaths among Black women. The mortality rates of Black women are 5 times those of white women pregnant. Postpartum Black women were also more than 2 times more likely than white women to die of hemorrhage, severe bleeding, or embolism, blood vessel blockage. Embolism and preeclampsia and eclampsia tied for the leading cause of maternal death across all racial and ethnic groups during pregnancy or within 6 weeks after pregnancy. These were followed by postpartum cardiomyopathy, hemorrhage, and complications from obstetric surgeries such as C-sections or cesarean sections. Among white and Hispanic women, causes of maternal death ranked somewhat similar. However, For Black women, preeclampsia and eclampsia was a leading cause of maternal death, followed by postpartum cardiomyopathy, embolism, and hemorrhage. Ectopic pregnancies, which occurs when a fertilized egg grows outside of the uterus, it was found to be the fifth leading cause of maternal death for Black women and not a leading cause for white or Hispanic women. This brings us to the article on clevelandclinic.org, how race and ethnicity impact heart disease. Although cardiovascular disease is the leading cause of death in the United States, racial and ethnic minority groups carry a heavier burden of heart disease. Risk factors and diagnoses are most common among ethnic minorities, and social factors known as social determinants of health that drive these disparities. 41% of Black adults have been diagnosed with cardiovascular disease, compared to 36% of white adults. Non-white or Black Hispanic women are more than twice as likely as white women to have diabetes, which is a major risk for heart disease. And American Indians are 3 times more likely than whites to have diabetes. Social factors play the biggest role in shaping people's health. Some important factors include a person's ability to access money and resources for life's basic needs, quality education and health care, a safe living environment, for example, clean water and air, resources like nutritious food and fresh fruits and vegetables, and supportive relationships free of discrimination and violence. These are known as social determinants of health. Poverty might prevent someone from following a healthy heart diet, and if that person lives in a food desert with no healthy options for food, the choices are very limited. So, which ethnic group has the highest rate of heart disease? They vary depending on specific diagnosis. But here are some key findings in the United States for heart failure. Black men have a 70% higher risk of heart failure compared with white men. Black women have a 50% higher risk of heart failure compared to white women. Black adults are more than twice as likely as white adults to be hospitalized for heart failure. They also spend longer time in the hospital and are more likely to be admitted again within 90 days. Non-white or Black Hispanic adults are more likely than white adults to have heart failure. Oh, this is very interesting. Findings. Now let's look at coronary artery disease and heart attack. Black women are more likely than white women to have a heart attack. Black adults are more likely than white adults to die from a heart attack. Asian adults are less likely than any other groups to have coronary artery disease. But there are some differences by ethnicity. Asian Indian men, Filipino men, and Filipino women have a higher risk compared to white people. Young Hispanic women, non-white or Black, have a heart disease, who have had a heart attack, face a higher risk of dying compared with young Hispanic men, their counterparts. They're also more likely to die compared with young Black adults and young white adults. As it relates to strokes, Black adults are more likely to be younger and are more likely to die from a stroke compared with white adults. Mexican American adults are more likely than white adults to have a stroke. One study showed Filipino women are twice as likely as white women to have a stroke. Vietnamese men and Korean women are more likely than their white counterparts to have a hemorrhagic stroke, which is a severe bleeding in the brain caused by a ruptured blood vessel. Filipino adults, Japanese men, and Vietnamese men are more likely than white adults to die from a stroke. These are some stark and bleak comparisons. As mentioned in the previous video, being proactive, checking your numbers, being physically active at least 3 to 5 days a week for 10 to 30 minutes, rethinking your smoking and drinking habits, and having conversations with your trusted doctor can help with your heart disease or even preventing heart disease. In this video, we've categorized the most impacted groups by age, gender, and race, and concluded with ways to reduce the impact of CVD on all groups, but specifically the most impacted groups. Our next video will be that of our specialty, CPR, cardiopulmonary resuscitation, some pertinent data, and how to perform CPR. I look forward to seeing you then. Please like, comment, share, and subscribe to our YouTube channel, Facebook page, Twitter, and IG pages. Thank you again for joining us.